Hey guys, beautiful morning, beautiful afternoon, and beautiful evening to every one of you. How we are doing? I know we are all doing well by the special grace of God. And how is preparation for your OSCE exam? Oh my God, I'm super elated, guys. I got too many messages for the past 10 days. It's been back to back messages. My own students whom I prepared for the OSCE exam, about 15 of them took the new test of competency and they passed at first sitting. Even a lot of my subscribers, I could remember about 15 persons messaged me and told me they were writing last week, oh, Nosvi, pray for us, we followed your videos, and they all passed. So guys, I'm super proud of you all who have passed your exam. Welcome to your band 5 rules. And like I keep saying, more than the sky is definitely going to be your limit. All right. So guys, if you're meeting me for the very first time, my name is Violet Okolocha. I'm a Nigerian and I practice here in the UK. So on this channel, I actually talk about everything you need to know about nursing, OSCE I'm here in the UK, and about your health. So guys, do well to keep encouraging me. Subscribe to this channel, like my video, and don't forget to keep a message for me. I really enjoy reading your message, and as much as I can, I always try to reply whenever you ask a question. All right, and most importantly, help me share this video with your friends who are preparing for OSCE exam. I keep getting messages of receipts, and each time I look at their receipt results, I'm like, it's well spelled out on my channel. Like somebody having A to E assessment with depression, failing it and sending me results. I can't find any useful resource on the YouTube about it. And I sent her the video and I said it's on the channel. And she was like, no, Violet, I go to see this after I had failed. No way. Please share this video with your friends preparing for OSCE exam, as the aim of this channel is to make sure everybody passes their OSCE exam at first sitting. So guys, today we are going to be completing our series on evidence base. We've done a lot with, if I think we've covered all on professional values. If I'm wrong, please send me a message to tell me I'm wrong, but I think we've covered every topic on professional values, and we are just left with what evidence base. Now evidence base is a silent writing station. It is silent because you don't have to talk with anybody, and it is a writing station because you always have to write. So what you do, you get a form. Just give me a minute, guys. You get a form like this. Here you write your candidate's name, you write your name, and you write your answers in bullet points. The time allocated to the station is 10 complete minutes. It's a very simple station. So what are you expected to get? You get a scenario, and after getting a scenario, you get an article summary. So you get a scenario and you get an article summary. So make sure you read your scenario and the summary of the research. So your scenario, after reading your scenario, you have to read the summary of the research. Like I said, it's a silent writing station, and I will advise you to make sure your handwriting is clear and legible. All right, so for evidence base, we have 5 topics you are expected to cover. Of these 5 topics, you can get just one in your OSCE exam, but the thing is, you don't know the one you'll be getting, so it is important to prepare for all of them. So we have diabetes marking criteria, which we'll be doing today. We have female myocardial infarction. We've done that already. We have pressure ulcer prevention. I will be doing that as well today. We have smoking cessation. We've done that already. And we have use of honey dressing for venous leg ulcer. We've done that one already. So let's get started on what? Diabetes marking criteria. So for diabetes, you get a scenario, and like I said, after reading your scenario, you get an article summary. So this is a formulated scenario, and we're going to be solving the scenario. All right, so now this is how it comes. Overview. They're advising you overview. Read your scenario and the summary of the research below. Identify the main point from the summary and apply findings to the scenario below. This is a silent station. Please write clearly and legibly, and you have 10 minutes to complete the station. Now, a lot of people come and ask me, how many bullet points are we supposed to give for evidence base? 5 is okay. 5 is sufficient. All right. So now let's read our scenario together. Mrs. Ellie Brooke is a 80 years old lady who have arrived for a routine checkup with her GP. Her GP notes that she has a family history of type 2 diabetes, heart disease, and stroke. Mrs. Ellie Brooke has a medical history of hypertension and hyperlipidemia. Her HbA1c of 8%, which is an estimated average glucose of 183, and a fasting blood glucose of 173. A diagnosis of type 2 diabetes is confirmed by further blood tests. Ellie Brooke is reluctant to start medication and is asking her GP for alternative therapy. She states that she's very concerned that if she starts the medication, she might become hypoglycemic. After a thorough explanation regarding the benefits of glycemic control and her family personal medical history, Mrs. Ellie Brooks agrees to start taking metformin. Now, I've read the scenario. Now it's article summary. So after your scenario, you get an article summary. So article summary, study A shows that hypoglycemia does not usually occur in people who are not on insulin. However, monitoring and controlling blood glucose decreases what? The complication of hypoglycemia. Now, study B states that hypoglycemia is more likely to occur in diet-related factors such as reduced calorie intake, skipping meal, or drinking large amounts of alcohol. Now, study C shows that symptoms of hypoglycemia are polydipsia, polyuria, rapid breathing, flushing, confusion, drowsiness, and fruity breath odor. Now, study D shows that acute illnesses such as sepsis can result in irregularities of blood glucose and lactic acidosis. And monitoring of blood glucose frequently will prevent complication. Now, study E shows that it is important to provide family members with information about the illness and symptoms of hypoglycemia. Now, I try to be slow because a lot of my Indians and Filipinos are like, I'm fast, okay? So I try to be slow. But however, if you didn't get it, just reverse it and get it. So if you read this whole scenario and you read the article summary, there's something you should be sure of. The person is trying to talk about diabetes. She has been diagnosed of diabetes and she is scared that if she takes the medication, she can have hypoglycemia. So now they have told us to write our answers in bullet points, and the time allocated to this station is 10 minutes. So now, what will now be your advice to Mrs. Ellie Brooke? So now for me, I wrote here, I would inform Mrs. Ellie that she is less likely to suffer hypoglycemia as she is not prescribed insulin. Now, these answers I'm giving you, whatever scenario you get in evidence-based, as long as it is under diabetes, these answers follows. What do I mean? Even if you get a different scenario on diabetes from the ones I've given you, these answers I'm giving you now follows for any diabetes evidence-based scenario you will get. Okay? So the first point is I would inform Mrs. Ellie that she's less likely to suffer hypoglycemia as she is not prescribed insulin. Although hypoglycemia remains a serious concern, she should monitor her blood glucose level and be very vigilant to recognize the signs and symptoms of hypoglycemia. Tick! And number 2, you don't need to write number 2, you just write bullet points. I would advise Mrs. Ailey that hypoglycemia episodes are often caused by diet-related factors such as missing a meal or not eating enough. I would inform Mrs. Ailey that it is really important for her to eat regular meals. The third bullet point, I would advise Mrs. Ailey to observe for excessive sweating, feeling of fainting, lightheadedness, blurred vision, new confusion, nausea, and call 999 if she experiences any of these symptoms. The fourth bullet point, I would advise Mrs. Ailey to inform her family and friends that should in case she appears confused or loses her consciousness, she may be having an hypoglycemic episode and will need an emergency medical help. Then, number 5, I would inform Mrs. Ailey, that's number 5 bullet point. I would inform Mrs. Ailey that an episode of acute illness may cause what? Irregularities in her blood glucose. So she should monitor her blood glucose frequently and report any changes at all to her GP. So guys, this is all you need to know about diabetes evidence-based. Really simple and straight to the point. All right, guys. So guys, I'll see you in my next video on evidence-based, and until I see you again, keep passing your OSCE exam. Don't forget to like this video, don't forget to share with your friends preparing for OSCE exam, and don't forget to subscribe. I love you all, guys, and bye.